Number one. Are you ready? Are you ready?
Tremendous show, tremendous success.
Hello everyone, I'm Mark Szuszkiewicz and welcome to Final Takes. I'm here with Dr. Zachilli, who actually performed the surgery on me but we're talking about sports injuries. We're going to talk about Kevin Durant's injury, which I'm sure a lot of the Brooklyn Nets fans are very concerned about. But before we get into all that, Dr. Zachilli, I've met a lot of doctors in my years, different clients that were doctors, etc. They all have different reasons for becoming a doctor. One of them actually said watching ER when he was younger motivated him to become a doctor.
There's some good scenes.
What motivated you to become a doctor?
For me, to be honest, most doctors I think want to be doctors first, and then they decide what they want to do. For me, sports medicine and sports in general has been something for me that's central to my life.
That's great. And now, as far as your background, Harvard Medical School, can you tell everyone out there about your background?
Sure. So actually, it's not Harvard undergrad. I went to UMass Med on a delay, and then once I finished there, completed all my orthopedic training basically in the military. My first 5 years in practice were with the military.
So not only were you in the future helping athletes get back on their feet, you were helping military.
Yeah. The soldiers were a big part of it, and something I still miss. I mean, that helping, and even here in New York, one of the great things, I live in Staten Island, and being down in Greenwich Village, we're kind of surrounded by a lot of the first responder community. So I still get to touch that a little bit, and it's always a big source of pride for me to serve this service.
Definitely, we appreciate you helping out in that sense. Now, you've seen a lot of injuries in your career, obviously. What would you say, from an athlete's perspective, that's the toughest injury to come back from?
Sure. Well, I think we have a couple examples recently. Teddy Bridgewater, a knee dislocation for most athletes. I mean, that's not just a season or career-threatening injury. That's a limb-threatening injury. So that's got to be number one. With the bigger knee dislocation sorts of injuries, we see artery and vein injuries or nerve injuries in anywhere from 25 to 40% of patients in the more serious injuries. And that's a steep cost. And oftentimes we can get the ligaments fixed, but it's the other stuff, getting the nerves reconnected and working right, and the muscles responding, and the motion back, and to function at that high level where you're doing rapid response. I mean, those can be bad injuries to come back from just to live your day-to-day life sometimes. Mm-hmm. So to come back from that and play sports, especially at the collegiate or professional level, that's something special.
So what would you say the percentage chance of that actually happening?
Oh, that's a good question, and it's a very patient-specific answer. It depends on some really close variables. So I have a young man right now that we just recently did surgery on, and he was 2 weeks away from his MLS tryout, and suffered a knee dislocation. So
wow.
You get into the trenches early, and you talk to the patient early on, and let them know, these are the odds, and so much of it depends on the support system. So the surgery is a very, very small part of what goes into that. The therapist, the family, the support system they have socially at home, nutrition, you name it, and the understanding of the coach and the team, the timeline, all that plays a role. When we have if you suffer an injury like that later in your career, towards the peak or the decline, that's probably a career-ending injury. If it happens early on before you're recognized and see the opportunities that maybe you would have had, if it happens late in high school, early in college, sometimes that can derail the scouting process. So it really you need to come into it with the right mindset and understand from day one the sorts of effort you're going to have to put in. But we see guys like Teddy, and he's been performing fairly well. Obviously, if you're in the NFL at any level, regardless of where you rank with QBR,
yeah.
If you're in that level, you're you're performing above 99.99% of the population. So it's achievable, but it's about the time you put in.
And obviously, a sports injury takes a mental toll on you too, losing the ability to walk, and
Huge.
that's something that people have to deal with as well. So, what advice do you give to your patients who are suffering from something that's devastating and could be life changing?
Absolutely, yeah. I think having the right attitude right off the bat and understanding, you can have a terrible injury like that. You don't give up, right? If the goal is to get back to the sport, you understand what the odds are. You maybe understand some of the statistics and the percentages, but odds and statistics matter for large numbers of people.
Yeah.
If there's
some people that have a different mindset
Right.
and just don't do the physical
Right,
therapy,
exactly,
don't care about their
exactly.
diet, and
Yeah.
then they're not going to heal.
Right, and you understand that 10%, okay, 10% means 10 out of 100, but who chooses who those 10% are? And, I play a small role in that, but the patients play a very large role in that. You as a patient, you determine a large part of where you fall on that line. Are you one of the 10 or one of the 90? That's in large part your decision and your effort. And if you understand that, that can go a huge ways. And I think that also from a mental standpoint, emotional standpoint, can keep you focused. So that's where I came from. I went into, when I finally had to back away from sports in college, I had one too many injuries and was at risk for losing my military scholarship at one point. And so I had to give it up. And that was I was depressed for 6 months. I was full clinic, now I recognize it now, I had no idea then.
Yeah.
But clinically depressed probably for 6 months because that's how I defined myself. I was an athlete. I mean, the reason I was going to be a sports doctor was because I was an athlete who was not going to play professional sports.
Yeah, part of being active helps your mental
Right.
health, having exercise, and
huge,
now
it's
you're
huge.
sidelined and you
Right.
can't get that exercise
Right.
that you used to. So, not only are you depressed about the fact that you might not be able to play again, but the fact that you're not as active, you're not getting,
Right.
the same mental health effects of exercise.
Sure. And I think there are a couple of things. So first off, the physical effects of exercise, the chemical effects, they release endorphins in your brain. Sports is a drug, and every
Yeah.
fan knows that, right? So just because you maybe can't do the sport that you want to be doing doesn't mean you can't have some sort of physical exertion and still grab onto some of those endorphins. And so rehab can be that. Therapy can be that if you approach it with the right mindset. Find a way to make it fun. Find a good therapist who knows how to make it challenging and fun. So I think that plays a big role. The social role, I think, of sports is huge too for most athletes, especially team athletes. So just because you're injured doesn't mean you can't be around your team. I think the people who segregate themselves and remove themselves, that's not helpful from the social standpoint. Some people are built that way, and that's how they function. But most athletes are gregarious people, and so finding a way to still be involved. The high school kid who stays on the sidelines with his football team all season long, carrying a clipboard and learning from coach, that goes a long way to the mental recovery aspect.
Yeah.
And it keeps you engaged with the team so that it's not over, right? Just because you're on the sidelines, the season's not over. The season's still going on for everybody else, and you can be part of that. And then the last thing is some people do need that extra little bit of support where it's not just being involved. It's not just doing your therapy. Some people need the extra coaching. And so, sports psychology, there is a reason the Red Sox and I'm a New England fan, full disclosure, right?
Yeah, I figured as much based on the schools you went to.
So I tamped down that accent, but that's where I live in my heart. So.
All right, the show's over, ladies and gentlemen.
Canceled. I'm done. There's a reason that those guys employ basically sports psychologists, mental health specialists all the time. They're there for a reason. If we look at I think a great example of that is if we look at ACL injuries. Everybody knows what an ACL injury is mostly, right? It's a ligament in your knee, blow it out, your two bones don't move the way they're supposed to. So if we look at what's the success rate of surgery, if I look at how successful I'm at making your ligament work right again, it's 90-95%. Our rate of success is very high. We're good at that surgery. But if we look really closely, and it depends on how close you're willing to look, but if you look really closely at your outcomes, which we've done better over the last decade, some studies show that the real return to sports rate at the same level is as low as 65%. So what accounts for that? What accounts for that 25% differential, 30% differential? If my ligament feels good when I examine it, but you can't play, what is that? And that's that confidence, it's that drive, that sense of belonging that you need to get back. And so if you need help getting there, there's not a problem with that. If 30% of ACL tears have that problem, then 30% of all injuries potentially have that problem. And so you can get ahead of it and get that support if you need it. And so I think that's something that's oftentimes overlooked. But every major injury, it's not just an injury of your knee in your case, but some of that injury is up here.
Yeah. Well, I mean, in my particular case, fractured tibial plateau with displacement, which once I found out the diagnosis, obviously WebMD and all that stuff, figuring out what the deal is, and I realized that surgery was pretty much inevitable. But at the same time, the initial reaction is a depressing thought. But at the same time, you told me I might not be able to play sports again. And at the same time, that's like, okay, I've lost 40 pounds since my injury. And, I made sure, I got to go a strict Tom Brady type of diet or something and get this, get this healing as fast as possible. Make sure I'm doing the physical therapy at home every day. And, I still don't feel comfortable running, and I don't know whether I ever will, but just because I can't run doesn't mean I can't walk. And I walk every day at least 3 miles now, and that helps with the, getting some type of exercise like we alluded to before with the endorphins, and I still hit the boxing bag and do what I can as far as, exercise to, it was almost in a sense a blessing in disguise because I'm way more self-conscious about my health than I was prior to the injury. So.
And I mean, that's, your injury falls in that, we talked about knee dislocations, but your injury falls into that category. I mean, that's one of those potentially life-altering sorts of injuries. And, you kind of embody the typical athlete, and sometimes the danger. We can talk about some of the other stuff that falls into this category later, but you're one of those guys who, like, initially got the, like, okay, I think you're going to be all right? And the power of the mind, like, how long did you walk on that for?
4 days.
I mean, that's incredible.
Well, the FDNY trainer went and said everything was fine, and I should have went to the hospital that day. I mean, I'm hearing pops in my knee and stuff, and that's when I'm like, all right, well, I think something's definitely wrong here. I'm not getting any better. I got to go to the hospital.
I can't blame him. You exude confidence, and so like I probably would have convinced me you were all right the way you walked in the clinic without anything on. But that's the power of the mind, and that can go two directions, right? Like if you get down into the injury, you look on WebMD and like forget, I have a broken bone, I probably have cancer too, right? Like if you're reading too much. So, you can get down and you read statistics. If you get the wrong way and that's where your mind goes, you're going to drive yourself that direction.
There's only a 10% chance or 20% chance, then you're factoring in that you're automatically in that 80 or 90, when meanwhile you could be in that 10. You could, make all the steps like I'm going to be in that 10.
Yeah, you're well on your way. I think we talked. Your first post-op visit was very clear, and that's not a testament to me. That's a testament to your approach, right? And we talked a little bit return to sports and what the numbers are, and people who have resources. Like if you're Kobe Bryant and you got trainers and doctors in Germany and a nutritionist that comes to your house and masseuse and everything else, you have all you're going to be at an advantage. Well, what do? You educate yourself, become your nutritionist, understand your therapy, participate extra so you make it that much better. Find the right guy, participate actively. Don't just show up and occasionally do it. And so you can bring those resources to yourself if you bring the right mindset.
Now, crutches are good exercise too. I don't recommend the injury diet though. I mean, people say, "Wow, you lost so much weight. Maybe I should break my leg too."
That's if you do, we have a great program. But no, I generally avoid that. Especially tibial plateau fracture. If you're gonna get hurt, sprain your ankle.
Call Tanya Harding if you want to go on the injury diet. She'll take care of that for you. But you mentioned Kobe Bryant before. He actually had a similar injury, but his didn't have a displacement. I was reading an article about him and how he wants to know every little detail about it, with doctors, why do this, why do that, what's the reason for that. He's not just like, okay, this is what I need to do and that's it. He wants to know every little detail about everything before proceeding with the way he went. And he didn't need surgery because there was no displacement. But
and I think that's the way he approached the game too, right? So he's that analytic guy, and some of that too that's the challenges we face with different patients, right? And you're kind of one of those guys, like you've been engaged. Some guys, I sometimes see a patient in training room at the college, and you can tell, or you even speak to them a couple minutes. They don't want, like, I don't want to know. Just tell me what we're doing and like when we're going to do it. I don't want to hear these things. And so that
you're the one that went to school for this,
Right,
not me. I
right.
don't want to know the details.
Right.
Yeah.
And that can be a blessing and curse, right? That falls in the category like a guy who he doesn't want to know how bad it can be. Fine, but it also means that sometimes it takes a little bit more education, or the support system has to be a little stronger with a patient like that.
Now, for the topic that a lot of the Brooklyn Nets fans want to know is, the situation with Kevin Durant. Now, the Achilles tear. To give the Nets fans some hope. Dominique Wilkins was an athlete that recovered from an Achilles tear and still was fairly successful afterwards, but it's kind of few and far between. Kobe Bryant had it as well, I believe, later in his career, but you can't really compare that because that was, on the latter part of his career. So, but why is it such a difficult injury to come back from?
Well, there are a few things that come into play, and part of this disclaimer is like I've not participated in his care, and I've not spoken personally to doctors. I don't know the details. I haven't seen his scans. So
Let me make some phone calls and make that happen.
This is based on the common knowledge stuff and the stuff that's around the orthopedic community. But why is it such a difficult injury to heal from? Well, first off, we get back to that biology thing. So an Achilles rupture, usually when we're dealing with an athlete like him, especially someone who had some symptoms leading up to the rupture, that's usually an indication of some biology problems, right? It's like that tendon prior to that rupture probably wasn't perfect. He'd had that calf strain, had been having pain. Those are probably subtle indicators that we're not functioning at 100%, which an athlete at his level, like a 1% difference like someone who's operating at that high of a level, a 1% functional change, you can notice it in things like strains. You or I wake up with strains, and I'm not an athlete anymore. And it doesn't change my function, but someone like that is really high functioning. It's like a Ferrari, So when you're dealing with that, and one of the components isn't quite right, how do we deal with that? How do we understand that? And in the case of Achilles, we're dealing usually with a chronic inflammatory issue. Usually, as we get older, our blood supply is not great, and the tendon is a structure that's made almost entirely of proteins and collagens. It's very little of it is actually really, when we think about alive, very small percentage of it is actually alive. And the blood supply to it is fairly limited. And so that's blood supply and cells are what are required to build back tissue when we injure it. Our skin heals great because it's made out of cells and has great blood supply. The tendons don't do that. That's why we get rotator cuff injuries and patella tendon injuries, and the Achilles falls into that category. So that's one of the issues. The other issue is just mechanics. He's not a small individual. If we look at mechanics, that is a lever. When he's up on his toes, that Achilles and where it's pulling on his heel bone, that is counteracting the entire weight of his body that's pushing down on that heel. That is a lot of force, and it's a lot more force in a big guy. And then as you increase your height, the distances increase, and so that's a multiplication factor for the stresses that tendon is going under. So the bigger you are, the taller you are, the higher stresses that tendon is going to experience. So and that creates some challenges. And then functioning with the demand that he does with the high impact activity, high velocity change in directions, these are things that tendon is even under bigger stresses for. So that's the baseline. So we can get it back together, but ultimately that biology is going to have to build itself back up in order to accommodate those loads that in a guy like Kevin Durant compared to a guy like me, those loads are exponentially higher. So that's the challenge there is the biology, and how do we fix that? And the answer is we don't know that yet in a lot of ways. We can optimize nutrition, and we can, in the case of tendons, we know that early motion or early exercise, early weight bearing actually can improve the strength of the tendon as it heals within the confines of controlled environment. But we don't have a magical injection that can reverse that process that had it being degenerative to begin with, right? So and we're kind of at the cusp of understanding some of that stuff, but we're not there just yet. So that's the big problem, is because that's a problem that we don't understand fully, and we can't just fix, because we can put the torn ends together, but the body has to do the rest. The good news for a guy like Kevin is that, and so unfortunately the science is too new for some of this stuff, but some of our newer techniques to fix this injury over the last 5 years really show a significant increase in the strength of the repair. And so what we've been able to do with some patients, and this is a person-to-person thing, but in some patients we're allowing them to get back earlier, faster, because the stitches that we use, and now we're actually using screws to hold that tendon down to the heel bone frequently, kind of creates an internal splint to that tendon. So while that biology is trying to catch up, what we put in there, in fact, in some biomechanical studies, what we put in there seems to be stronger than the Achilles was to begin with. So it can provide enough support where that tendon early on isn't seeing the full load. We're protecting that and allowing that biology to take its time and heal. So I think that's the promising thing for him. The downside is, like, we don't have a large number of NBA guys of his size to look at and say, what's the return rate? How many of them get back to full level? Most of our research on this, in order to get, one of the bigger studies on this, we looked at 60 people from like starting out in the late 80s, early 90s until like 2014, and we got like 60 players. Well, first off, we're not repairing them the same ways anymore. Mm-hmm. Second off,
even back in the Dominique Wilkins days, a lot's changed since then.
Right, a lot of change, and the game's different too, right?
Yeah.
Like he's not the same player. How do we compare him to a guy that was playing back? It's not the same game even. So some of those questions just we can't answer, and the numbers are very small. So
well, the game's a little easier now.
The game's a little bit easier, right? So we don't know how some of those numbers translate. I would say I think from a surgical standpoint, our newer techniques are better. He's also bigger, and it's going to be something where they're going to evaluate him as he progresses. But I would say that over the last 5 to 10 years, we have been more aggressive about getting Achilles ruptures back to activity faster with this newer technique, or newer techniques, because there's more than one. I think that's promising. What we do know from the old stuff is the first year back, expect him to probably be not quite the player he was, at least if some of the old data holds true. That first year, we're looking at decreased efficiency and probably 75% games if this historical data holds true. But some of the newer studies are showing like that second year, if you're still playing 2 years out from the surgery, we're getting back, whereas the statistical difference from where you were before the injury and where you are now is actually not significant. So,
yeah, but even if you weren't injured and you didn't play basketball for a year, obviously it's going to take a toll on you. So it's not just the injury; it's the fact that you haven't been shooting around or doing anything, and it's just a matter of getting back into it.
Right. Well, and no one knows really what's going on there, right? So we don't know what Kevin's doing, but I'm sure his trainers have him on track with getting some of that early activity, and they're the ones who are going to know. We're not. We'll find out when we find out. But I would say that if we're looking at the old historical stuff, the newer stuff is more promising, and so I'd hold out optimism if I was a Nets fan, not just for that reason, right? So it's a good time to be a Nets fan. So you'd be relatively optimistic, but it's going to be a year or two.
Unfortunately, I'm a Knicks fan, and I've been suffering. And the news of him going to the Nets was sad, but at the same time, the Knicks, with all the statistics out there, the probability of him coming back to full form, paying him for a year of doing nothing, and all that, it just seemed like it wasn't the right move. But recently in the news, they were talking about he might come back at the end of the year, and now you're putting that pressure on him again.
Yeah.
And what do you think as far as? I mean, you obviously don't have the data, and you need to only his trainers and himself will really know. But at the same time, what do you think as far as him coming back before the end of the season, come playoff time, if they are playoff in the standings for the playoffs?
Yeah, I think that theoretically it's possible. Yeah, and again, that's patient specific, and some of that decision of like, would you put it out there or not? I think some of that is also driven by like coaching staff and training staff, and how different players respond. Like, how much of that, when it's put out to the public, is a measured decision by the training staff or by the coaches to try to drive that mental aspect of things. Mm-hmm. Some players need to have the light at the tunnel. Some of them you don't want to give them that, right? Like we follow Sam Darnold, and like, is it good? Is it good right now? This is a big talk. Like, should we say that maybe he might play? Should he even think about that? Like, and that's, that's something that intimately the training staff, the coaching staff, the medical staff, you need to understand the whole patient, not just the.
I'm sure in some ways it's good to try to motivate yourself to, this is the timeline I want to set for myself, and
Right.
even if you don't get it, at least you're motivated to try to get that timeline
Right.
done quicker rather than later. On the flip side, you saw with the NBA Finals, they wanted him to come back from
fast,
the calf
right.
injury,
Yeah.
and they turn around and say, "Oh well, it's a Achilles injury, so it has nothing to do with it." I mean, the calf and Achilles,
And I mean, would it have prevented it if he hadn't played? Probably not. Like that, at some point, that was going to progress most likely if it was at that level. But is it related? Personally, yes, I think probably there's some relation there.
Yeah, I mean, it was the same leg. If it was a different leg, then
that's always the question mark, right? Like, as a sports medicine doctor, like my goal is to get you back to sports, but there's also the role of protecting the players from themselves, and I think that's the benefit of having been an athlete. Or like seeing patients like you or my Army guys, who some guys will just, drive on, right? Walking on a broken leg for 4 days, or crazy things that some of my military guys would do. A guy walking around with a knee dislocated for like 3 days. The sports world is full of these. I mean, there's some stories of NHL athletes who played with broken legs taped together in the Stanley Cups. So guys will hurt themselves if given the chance, and that's that athlete mentality. It's the same thing that allows us to be great, like the story of marathon. Like the reason that guy was able to run the first marathon, because it was that important. It was mind over matter, and then he died. So we have to protect our athletes, and that's a fine line. And knowing the individual person, how they respond, that's the art, right? That's the art of being a trainer or being a therapist or a doctor, is being able to read the person. So, there are patients that come in and you do not give them that like maybe, because you learn quickly. A lot of times they'll give you the hints with the story of how they got injured. You don't want to give them that maybe, because they'll take that and they'll take -2 months.
Well, pretty much almost out of time. Is there any information you want to give to fans out there about yourself, how to contact you, social media or otherwise?
Sure. So I'm available. My office, best way to get an appointment, I'm on ZocDoc. You can call my hotline. Our hotline for appointments is 1-833-9-SPORTS. I'm with Northwell Health in Lenox Hill Hospital, located in Greenwich Village in the old St. Vincent's building, so on 13th and 7th. Social media handle for Instagram is Sports Surgery NYC, and similar for Twitter. So you can look me up there, and try to put out some educational information on there when we can. I think the biggest takeaway from this is, understand when you're hurt. Come and find us. We'll do our best to take care of you, whether that means sending you on your way with a pat on the back, or what we did with you.
All right, sounds good. So make sure you're checking out finaltakes.com. Follow us on Twitter and Instagram. If you're watching this on YouTube, make sure you hit that subscribe button. And if you're on Instagram, tag @FinalTakes for a chance to be on the show. Tag us in your videos, and possibly play that on the show. So thank you for joining us, and thank you
for
Dr.
bringing me in.
Zachilli.
It's been a pleasure.
It was great talking with you about all the different sports injuries. And for the fans out there, we'll see you next time on Final Takes.
Tremendous show, tremendous success.